We're going to dissect the structures in both the forearm and hand, so you'll spend probably several days working on this one. So if we start first of all with the muscles in the anterior compartment of the forearm, what you'll find is that several muscles originate together from the medial epicondyle of the humerus, and then as you follow them down distally through the forearm and into the hand, you'll see that they split off into slightly different directions and attach differently distally so that we can separate the muscles that way. Now looking at this common muscle mass, one of the muscles originating there will end relatively quickly by attaching approximately halfway down along the shaft of the radius. This is the pronator teres muscle. Right next to it in sequence is a muscle that will only go as far as the wrist, the flexor carpi radialis. Next in line, you'll find a relatively wimpy muscle with a small muscle belly and then generally a long, slender tendon, which does continue all the way distally into the hand, and then it expands out into a sheet of dense connective tissue called the palmar aponeurosis. This is the palmaris longus muscle, which goes right across the center of the wrist. Slightly deep to that is another muscle that is going to have multiple attachments once it gets to the hand. This is the flexor digitorum superficialis muscle. And as we follow those tendons eventually into the hand, we'll see that it attaches to digits 2, 3, 4, and 5 and helps to flex them. The final muscle that originates off the medial epicondyle is also just going to make it as far as the wrist, and it's called the flexor carpi ulnaris muscle. Now to look at some of the deeper compartment of muscles, we can pull aside or literally cut and reflect some of the more superficial muscles. So we'll reflect the palmaris longus out of the way and just bluntly pull apart some of the more superficial compartment muscles. And one that you're going to see down in here in the deeper compartment is also a muscle that's going to attach to digits 2 through 5. This one is called flexor digitorum profundus because it's deeper within the forearm. Okay. And pulling that aside, now we're going to find a muscle that's going to attach to and move the thumb, the flexor pollicis longus. The final muscle in this anterior compartment of the forearm is very deep, and it's unusual in that its fibers are running transversely between the radius and ulna. This is another pronator muscle called the pronator quadratus. Now in terms of innervation of this compartment of muscles, there are two nerves that are branches of the brachial plexus, the median nerve and the ulnar nerve, that are responsible for innervating the anterior or flexor compartment of the forearm. Now moving to the posterior side of the forearm, again we're going to identify multiple muscles, and if you just keep in mind the fact that these elaborate names describe the positions of the muscles and the actions of the muscles, it becomes a little bit easier. If you follow directly back from the thumb, this muscle that you find on the crest of the forearm, really halfway between the anterior and posterior compartments, is called the brachioradialis, attaching from the humerus down to the distal end of the radius. And that's stacked with two other muscles that are going to help move the wrist. So we've got the brachioradialis. Just deep to that is the extensor carpi radialis longus. And again, one layer deeper is the extensor carpi radialis brevis muscle. Now if I roll the forearm across slightly, we are clearly in the extensor compartment. And again, we've got a muscle that's going to move digits 2 through 5. But in this case, there's only one muscle that will move all 4 of those digits, so it's simply called extensor digitorum. If we continue moving across the forearm, one muscle, which appears really to be part of extensor digitorum, has a tendon that only goes to digit 5. And what you're going to learn as we go along is that muscles that move digit 5 have the terms digiti minimi in their names. And this is the extensor digiti minimi muscle. Finally, moving all the way across the forearm, again we get a muscle that will simply move the wrist, and this is the extensor carpi ulnaris muscle. As we did on the anterior side, we can look at some deeper compartment muscles on the posterior side. 3 of the deeper compartment muscles in the posterior aspect of the forearm are responsible for moving the thumb. And they form the boundaries of something called the anatomical snuff box, which is right here. And if you extend your own thumb, you can see that there's a depressed area at the proximal end of your thumb. And again, that's the anatomical snuff box. There are 3 tendons which form the boundaries of that landmark. If we start on the posterior side and work our way toward the palmar side, the first tendon that you encounter is the extensor pollicis longus. Now jump across the anatomical snuff box and we get the extensor pollicis brevis muscle. And continuing now more toward the side of the thumb is a muscle called the abductor pollicis longus. Okay? These are 3 deep muscles in the posterior compartment, all responsible for moving the thumb. Rotating the limb slightly, we're going to look for one last muscle within this compartment, which is responsible for moving the index finger, or digit 2. We've already seen the tendons of the extensor digitorum muscle that would attach to digits 2 through 5 and extend those fingers. We've also seen the extensor digiti minimi muscle, which has a single attachment to digit 5 and helps to extend it. And then finally, coming from the deeper layer here, you're going to see that there are 2 tendons attaching to the index finger. The deeper one, with the muscle belly back in the posterior forearm, back here, is the extensor indicis muscle. Okay? And again, that will help you extend digit 2. All of these muscles in the posterior compartment of the forearm receive their motor innervation from the radial nerve, the same nerve that innervated the posterior arm compartment. Now we're going to pick things up by following them distally into the hand and continue our dissection with the hand. And as a reminder, we have 2 arteries providing blood supply to the forearm, and both of them would continue into the hand, providing collateral circulation. Okay? Here on the lateral side is the radial artery, and on the medial side, the ulnar artery. Both the ulnar artery and the ulnar nerve are going to continue in a relatively superficial position as they pass distally into the hand. Okay? These are 2 structures that do not pass through the carpal tunnel as they pass distally. Okay? So as we look at the ulnar artery, you can see that it continues into the hand and forms the superficial palmar arch, literally arching across the palm of the hand. Okay? The ulnar nerve is in a similar position, also continuing and then providing branches within the hand. Now let's take a look at the superficial palmar arch, and you can see that there are branches coming off of it, continuing distally. These would be the common digital arteries, and as you follow them further, they're going to split and form these little Y-shaped branch structures, which will then help to supply blood to the lateral surfaces of the adjacent digits. And at that point, we would call them the proper digital arteries. Okay. The nerves are going to do a similar thing. So if we've got our ulnar nerve here and follow it down into the hand, again, you could name a common digital nerve, which then splits to supply the lateral surfaces of the adjacent digits. And these would be our proper digital nerves, branches of the ulnar nerve. Now to follow some of the other tendons and the median nerve, which you can see here, into the hand, we need to cut a structure that's called the flexor retinaculum. There's a very dense layer of connective tissue here spanning between the carpal bones, and that's going to hold the tendons of the flexor digitorum superficialis and profundus muscles, as well as the flexor pollicis longus muscle and the median nerve within a very tight space as they continue distally into the hand. When you're opening the carpal tunnel, the safest way to do this is to insert a scissors down through the carpal tunnel and then use your scalpel to cut until you run right into the scissors. That way, hopefully the scissors will be between the scalpel blade and any of the structures passing through the carpal tunnel that you'd like to save. Now let's remove this segment of the flexor retinaculum and see which structures actually pass through the carpal tunnel. We've talked about some of these already, and this is the median nerve passing distally into the hand. It does have many motor targets within the forearm, but also has multiple motor targets in the hand, including this mass of muscles that you find at the base of the thumb called the thenar muscles. And here we can see the branches of the median nerve that innervate the thenar compartment. The other structures passing through here would be the long flexor tendon to the thumb, the flexor pollicis longus, as well as both the flexor digitorum superficialis and profundus tendons, which will dissect more completely as we follow them distally. As we did with the ulnar nerve, we can see the digital branches off the median nerve. So we would have the common digital nerves as well as proper digital nerves. Now, in terms of cutaneous innervation of the hand, the median nerve is responsible for innervating 3.5 digits. Okay? So you can see the branches here going to the thumb. It would also innervate both sides of digits 2, digit 3, and then just the lateral side of digit 4. The ulnar nerve will take care of the cutaneous innervation of the medial side of digit 4 and both sides of digit 5. Now, as we continue our dissection in the hand, we can look at some of the intrinsic hand muscles, including a group of 3 muscles at the base of the thumb in the thenar eminence, and a group of 3 muscles at the base of digit 5, the hypothenar muscles. And in both cases, you can use the mnemonic OAF, OAF, to remember the 3 muscles in each compartment. Starting with the thumb here in the thenar compartment, on the side of the thumb, we've got a muscle called the abductor pollicis brevis. You should remember that we had an abductor pollicis longus muscle as one of the 3 muscles bounding the anatomical snuff box. Now, I have cut the insertion point of the abductor pollicis brevis so that I can reflect it back and see the other muscles better. Another muscle in this compartment that's more on the palmar surface of the thumb and parallel to the tendon of flexor pollicis longus, naturally is the flexor pollicis brevis muscle. The final muscle, the one that runs diagonally here and attaches to the metacarpal of the thumb, is the opponens pollicis. All of these 3 muscles are innervated by the median nerve. Turning our attention to the hypothenar compartment, again, same set of muscles, the names are just slightly different. On the side of the hand, we would have the abductor digiti minimi. More on the palmar surface of the hand is the flexor digiti minimi. And then the deepest of the 3 muscles, with the fibers running more obliquely, is the opponens digiti minimi. The hypothenar muscles being innervated by the ulnar nerve. Now, the other things that we can see a little bit better now, because we've cleaned away some of the connective tissue, would be the 4 tendons of the flexor digitorum superficialis muscle, continuing down toward their distal attachments to digits 2 through 5. And if I pull those aside, again, you can see that there's a second tendon attaching to each of the fingers. Those would be the tendons of the flexor digitorum profundus muscles. Now, to really follow those tendons any further and to get to the distal attachments, what you're going to need to do is to cut through a dense connective tissue that binds those tendons against the bones of the fingers. There are similar structures to the flexor retinaculum that we saw at the wrist, in this case called the fibrous digital sheaths that bind those tendons down against the phalanges. So what you want to do to free the tendons is simply take a scalpel and cut right down the midline through the fibrous digital sheaths, and now the tendons will be able to pop up away from their position against the phalanges. And you can go ahead and do this along all the ventral surfaces of the fingers, and that will also allow you to straighten out the fingers and work a little bit more effectively. Now that I've cut the fibrous digital sheaths from each of the digits, what we can see here is a really beautiful arrangement between the flexor digitorum superficialis and profundus tendons. I've used the probe to snag all of the flexor digitorum profundus tendons as they're passing distally, and those are going to attach to the distal phalanges of digits 2 through 5. And what we've got here is an arrangement where the flexor digitorum superficialis tendon has got a split to get around the flexor digitorum profundus tendon, so that those superficialis tendons attach to the middle phalanges of digits 2 through 5. So really the only muscle that crosses on the ventral side of the interphalangeal joints and can flex the distal interphalangeal joint would be flexor digitorum profundus. If we look a little bit more closely at those tendons, what you're going to see is that there are some small muscles that are intrinsic to the hand. There are 4 of them. And these muscles, interestingly, originate from the flexor digitorum profundus tendons. Okay, they're called lumbrical muscles, and they pass distally and attach to digits 2 through 5, and will help to move the interphalangeal and metacarpophalangeal joints. Believe it or not, there are actually additional muscles that are even deeper within the palm. So to access those, what we've done is to cut through the muscle bellies and or tendons of the flexor digitorum superficialis and profundus muscles in the distal forearm so that we can take those tendons and move them out of the way to access the deeper structures. What we can see are some additional muscles that move the thumb as well as the other digits. The muscle that you see right in here is called the adductor pollicis. Of course, it's going to move the thumb and pull it back in or adduct it toward the rest of the fingers. That muscle is not innervated by the same nerve which innervates your thenar muscles, however. The adductor pollicis is innervated by the ulnar nerve, the major motor nerve of the hand. The other groups of muscles that we can see now at this deep level are the interosseous muscles. These muscles are called that because they originate between the metacarpal bones, and what they're going to do is pass distally to attach to the extensor hoods or expansions of the extensor digitorum muscle and use it as an insertion point. Now there are two different sets of interosseous muscles, the palmar and the dorsal. And the easy way to remember the functions of those muscles is to remember the mnemonic PAD, P-A-D, and DAB, D-A-B. The palmar interosseous muscles adduct the metacarpophalangeal joint, whereas the dorsal interossei abduct the metacarpophalangeal joint. And in terms of ab and adduction, the reference point that we're talking about is digit 3. So whether or not a finger moves toward or away from digit 3 is how we describe the abduction or adduction. To get to these interosseous muscles, it's necessary really to cut the ligaments that normally prevent you from spreading your fingers too far apart. And we've done that in this case, and now by spreading apart digit 5 and digit 4 and looking at these small muscles between the metacarpal bones, we can see the dorsal and palmar interossei. Now, we don't recommend that you try and make a judgment about whether a muscle is closer to the palm or closer to the dorsal surface in terms of naming it, but use that PAD and DAB mnemonic. Think about how the muscle attaches to the finger and what it would do, and then name it accordingly. So for example, here we've got these two muscles attaching to digit 5 and digit 4. Imagine the contraction of this muscle would bring digit 5 toward digit 3, or adduct it, so that would be a palmar interosseous muscle. In contrast, this muscle attaching to digit 4 would pull digit 4 away from digit 3 when it contracts, so that is a dorsal interosseous muscle. All the interosseous muscles are innervated by the major motor nerve of the hand, the ulnar nerve. Getting this deep in the dissection, there's one other structure that we're able to show you, having removed all the more superficial tendons, and that is a small arterial arch called the deep palmar arch. This is a continuation of the radial artery that you dissect in the forearm and provides collateral flow with the superficial palmar arch, which was a continuation of the ulnar artery. There are interconnections between those two palmar arches so that if one is obstructed, the hand will still receive a blood supply. So again, you've got to dig very deeply to find this deep palmar arch and some of its branches, which pass between the metacarpal bones and are called metacarpal arteries. The last thing we'd like to do is give you a better look at this extensor hood or expansion that we've mentioned. This is the tendon of extensor digitorum, and because we're looking at digit 2, the extensor indicis muscle, and as they continue distally, they form this broad expansion or extensor hood right over the metacarpophalangeal joint. And that is not only important for the function of the extensor digitorum muscle itself, but it also serves as the attachment point for the lumbrical muscle for that digit, which we can see here approaching the extensor hood and attaching to it from the palmar side, And it also serves as the attachment for the dorsal interosseous muscle for digit 2. So again, interossei and lumbricals use the extensor hood or expansion as their insertion point so that they can affect movements of the metacarpal phalangeal, proximal, and distal interphalangeal joints.